Thank you very much. Good evening, everyone. Welcome to this evening's meeting of Worcester City Council Health and Wellbeing Committee. This is a public meeting and members of the public and press are permitted to report on the proceedings. Reporting includes filming, photographing, making an audio recording and providing commentary on proceedings. Please note this meeting is recorded and streamed live. These recordings are published on the relevant meeting page of the Council's website. By choosing to attend this public meeting, you are deemed to have given your consent to being filmed or recorded and for any footage to be broadcast or published. If the alarm sounds, the premises must be evacuated immediately. Do not spend time collecting personal belongings. All emergency escape routes are clearly signed. Once you have left the building, the assembly point is in the High Street opposite the Guildhall. Members and other speakers are reminded to use their microphone when speaking. Thank you. So have we any substitutes this evening?
Chair, no, we don't have any substitutes, got full complement of committee. Just say we have had apologies from Lloyd Griffiths and Shane Flynn as well.
Thank you very much. Any declarations of interest from anybody with regard to the agenda? Nope. Not seeing it. Okay. Doesn't look as though we've got public participation. No. Okay. So on to the minutes of the last meeting, which was the 22nd of January. If I go through page by page, if anybody has any comments or corrections that they want to make. So page 1 of the minutes. Page 2, page 3, page 4. So I'm okay to sign those as a true record. Okay, thank you. Which takes us to item 5, and welcome. So a presentation from MAGS Day Centre on behalf of other organisations as well, because homelessness and particularly health and well-being of homeless people is part of the remit of this committee. So over to you, Avril.
Okay. All right.
It's for the public.
Right. Okay. So, thank you for inviting me tonight. I actually represent St Paul's and MAGS in this presentation. Jonathan was going to attend tonight. Sadly, he's unwell. He has contributed to the presentation, and it's a shame he's not here because, of course, he would have relished the opportunity to talk to you. And this is very much Jonathan's scene. So I'll introduce myself. I'm Avril Gilmore. I, until very recently, was interim chair for MAGS. I now am just a mere trustee of MAGS. I revert to mere trustee. I've been with MAGS for 6 years in the trustee role. I found myself from October, November stepping up as interim chair, interim chief executive, because we are between chief executives at this time. So I have been interim chair and doing the executive aspects of the chief executive role as well. Hence, the invite was to me tonight. If we can go just to the first slide. I wanted to specifically, and obviously given the nature of the committee, make sure that we were focusing on health issues, health outcomes, health inequalities. And of course, I think members of this committee will be absolutely clear, having read the various reports and documentation, that homeless people and those in insecure and temporary accommodation, of course, have amongst the worst health outcomes government studies just after the national strategy was released in 2018 very much went into depth about the issues about mortality rates, the issues about the level of drug, alcohol, and mental health issues, particularly amongst the rough sleeping group. And within these risks, add the general risks, the vulnerabilities of just living on the street and being vulnerable to attack and to limited access to health opportunities. So in terms of Worcester City, looking at physical health care, associated with those reports at the time, there was quite a detailed report entitled All of Our Health by Public Health England. And that went into some detail about how primary care support services, GP surgeries specifically, could actually open up and begin to engage with this hard-to-reach group, presenting their difficult-to-manage behaviours. In Worcester City, we were very fortunate in that we had Farrier House. And Farrier House, really, in terms of MAGs and rough sleepers and homeless people, is really the stuff of legend. Dr. Brennan, his name is mentioned in dispatches. Nurse Heidi is an absolute symbol of hope in MAG's Day Centre. And of course, the reception staff themselves were indeed brilliant in terms of making that link, flexing around the normal, we only talk to the patient sort of relationship that can happen with GPs and medics. And the process and the facility was very good. Obviously, the closure of Farrier House, you won't be surprised to hear, was of concern to us. And notwithstanding the fact that we have established very good links with Martina Smith, who's the Commissioner for Primary Care Services with the ICB, and her colleague Amy, and they are working closely with us to try and deal with any barriers or problems arising from the closure. It is just clearly much more difficult to think of linking homeless people, people in insecure accommodation across the 9 other GP surgeries in Worcester. We're already starting to see registrations that are made falling away. The Farrier House would have worked directly with us, contacted our staff if there was a missed appointment, created bridges for us to reconnect service users very quickly into that provision. Obviously, the other surgeries just don't have that experience. And if they're going to apply, as they may well do, the 2 strikes and you're out policy, then you can immediately see the difficulties that we're in and likely to face with service users connecting, staying connected, and then retaining their health access and prescriptions, etc. Nurse Heidi, for instance, would come to Mag's Day Centre, and she had, through Farrier House, responsibilities for prescribing. So she could continue ongoing long-term prescribing for our service users, literally in our day centre. At the moment, Martina Smith is negotiating with the other 9 surgeries to see if that same facility can be set up for our new nurse, Nurse Gemma, which is important. If it can happen in the day centre and we can maintain that contact, it actually does make a considerable difference. Jonathan would say that obviously, given the hostel and the fact that that's a permanent address for his service users, they're not experiencing the same difficulties. But certainly, we are starting to see problems arising just now, 4 weeks in, and we're starting to see problems arising. The difficulty being that if one of our service users becomes deregistered, they go to another surgery, if it happens again, very quickly we could find them connecting with Tier 2. And what Tier 2 is a specifically commissioned service out of Bromsgrove for our service users. So we are concerned, but we are working closely with the commissioners and we are keeping a close eye on that. Mental health. Again, there's not many of the staff in MAGs who would not be saying to me, there are always difficulties in trying to link our service users into mental health provision. There's a high demand, The reports indicate over 50% of those sleeping rough on our streets will have issues with mental health. And there are difficulties in making that link, sustaining that link, and continuing with that contact. Obviously, missed appointments and intermittent attendance all again cause our service users to be dropped out of treatment quite frequently. So we do get into a revolving door. Bright Path is the Mental Health Rough Sleeper project. It's a relatively new initiative that's kicking off at the moment. It's started with the offer of some really good intensive training programs. Staff have already been involved in one run of the programme. There's another run ongoing at the moment. And that training, that skill, that knowledge, that facility through the mental health first aid training and the support that that offers and offers ongoingly to our staff is really very significant. That is now going to develop further into 2 senior mental health nurses being appointed across Worcestershire and Herefordshire. So again, the idea being that our staff, backed up with the training and the knowledge that they're accruing through this very intensive, very good training, will also have a point of contact with experienced mental health nurses to help them intervene in that period when maybe they can't get into mental health services direct, but they can intervene and be supported in some of that work with our service users and therefore start the process. And obviously we're looking to those nurses to then bridge into and help sustain and support our service users into mental health treatments. Drugs and alcohol, again, another significant area of need amongst this group. MAGS has been providing outreach services in Worcester City over a number of years, variously through City Council contracts, lottery money, and from our own grants that we attract in. We're currently supported in delivering the intensive transition team, but of course much more widely in terms of the RSDATG group. Tom, do you want to say what that is? There is really quite, well, not quite, it is actually a really, really good collaborative approach from the various agencies. So we have MAGS with the intensive transition team, we have Cranston and Emerging Futures around the direct drug and alcohol features, and St Paul's with the trauma-based counselling provisions. All those services work together. They back each other up because, not surprisingly, these are amongst the most complex and difficult of our rough sleeping service users. So it's tough work, and the opportunity for those agencies and their staff to back each other up. So MAGS will go out with Emerging Futures and Cranston will go out with MAGS, and variously there is backup. There's 1 and 2 workers involved with people, just to take a bit of that strain, to build the resilience and to build the capacity really into keeping that engagement going, what is inevitably over a long and extended period, to try and get people to the point of going into treatment. And then finally, when I think of physical health, I think of the support through the day centres, the hostels, MAGS supported accommodation. In the last 4 years, we've set up actual accommodation provision. We have now 15 units, which adds to the availability of accommodation, good accommodation for our rough sleepers and that really difficult to place group. And we have it so that it is supported, because that's absolutely key, through our day centres, through St Paul's, through Housing First, through the MAGS accommodation. We have supported accommodation, people in accommodation supported in terms of developing their confidence, their connections to live independently and their self-reliance over time. So again, really important provision. The chair asked about SWEP in particular as well, which of course is a provision operated by CCP in Worcester over the cold months, but also with global warming over the hot months as well. So in fact, it's cold when temperatures are due to be, is it below 0 or has it been lifted? Is it still zero? So That it will be called promptly once the weather indicates that temperatures are below that level. It's operated by CCP. It's been operating out of the Hope Church hub. So it's an absolutely critical provision that appears to work well. It was something that MAGS did years ago, but CCP have picked up in the last 3 or 4 years. And also in the summer, primarily it's about checking in with people, making sure people are properly hydrated, that people are safe in that very hot temperature and weather. Can we have the next slide? So that's the situation in terms of health issues, the provision that's around. In terms of the challenges and the risks that are around with maintaining that focus on health and well-being of the rough sleeping group, for an agency like MAGS at the moment, and indeed for Jonathan, part of the issue for us is we're on the bit of a cliff edge come the 31st of March 2025. There are a number of contracts and a number of funding streams that are coming to an end, and I think that's pretty consistent across all the homelessness agencies. In MAG's case, we have the ITT project, we have the harm reduction county provision that is due to fall away. We also have a navigation, which is a county outreach. So potentially we have in the region of 7 posts that may not be funded or not funded at the same level beyond the 31st of March. The difficulty with that is staff will start looking towards the end of this year. It's unlikely that staff can hang off until the 31st of March. They're bound to start looking. So actually holding, sustaining and maintaining that focus on services with that sort of precipice in front of us is a significant issue, I think, for all the charities. We also, interestingly, have a situation that now we have 12-month contracts being offered through the wider harm reduction provisions. That means quite high salaries, premium salaries. Obviously, if you're only offering someone 12 months, they might need a little bit of incentive to go and take that because there's an end of contract date. So what we're seeing is some salary inflation because of the costs attached to these one-year contracts. That's putting pressure on when I think of the ITT contract, which is priced so that it looked good in 2022 when it started. Those salaries are not looking so good now, so we are having problems recruiting to that post. The health and well-being of staff, we're talking about the health and well-being of our rough sleepers, but the health and well-being of staff is also a significant consideration for services. It is a tough job. Our staff need knowledge, skills, confidence. They need resilience, which is absolutely key. There is a risk of burnout. So good training, good supervision, good support, and indeed a good salary are all parts of what we need to be looking at when we look at developing projects and developing pathways for our rough sleepers. The Bright Path training, as I've said, is high quality, and hopefully that will continue to be rolled out because that is a significant boon to the homelessness charities at this time. Demand versus supplies. You won't be surprised to hear the demand stays steady and up. We have 23 rough sleepers, we're counting, in Worcester City at the moment. Obviously that went down to nearer 12 or 13 a number of years ago. We're back up now to 23 as an average for the Worcester City area. So the supply of healthcare, be that mental health access, be that physical care access, now with the closure of Farrier House, the challenges are significant, I think, and are going to become more so as we go through the next year. Contracting with less. I think we're realistic in the homelessness charities that money is scarce. There isn't a lot of money and it could become scarcer. So in fact, what you will have available in terms of contracting and contracting for services is of concern. High expectations, you want more for your money possibly. We're also concerned that charities will start to overpromise really in terms of what we can do with contracts falling away. I think one of the things that has been most successful, particularly around the RSDTG and Jonathan would certainly emphasise this, is the collaborative working together, the collaborative way that that contracting has been managed, the discussions, the building of the ideas, the looking for the flexibilities, the joint working, and the sense that everybody is working together with this. We are overlapping with each other to get the best possible services we can. And the charitable pot is becoming more difficult to access. So for the likes of ourselves and St Paul's, reaching out there for grants, getting grants, because of course your contracts will support us financially, but obviously the grants that we pull in as well sustain our services more generally. Some MAGS over the last 3 years has probably brought in over £1 million in terms of homeless provision within Worcestershire, more generally. Worcester City has been a focus for many years, but Worcestershire more generally. So we're both investing, both St Paul's and MAGS, investing in dedicated fundraising responses to make sure that we can draw in the money. But obviously the opportunity to work together and to work with the City Council on these issues is significant also. So final slide, the responses. I've mentioned meaningful collaboration at all levels, and particularly in reviewing planning and the commitment to delivery of services that work. Jonathan is very big on they need to work, Avril. We need to make sure that we're looking and researching and understanding what's working, the impact, the outcomes from what we are doing. And I think we're open to that, you know, I mean, open to sitting down, looking at what works best, and looking at how we can improve performance, particularly when we're looking at maybe reducing pots of money. Clarity on future contracts before December 24. I don't know what's possible, Tom, really. It's difficult. We're in a year where there's going to be an election. Things are changing, but it doesn't matter who's going to be in power or what's happening. The money is tight. It's going to be tight for quite an extended period. So we've got to work within the resources that are available. So opportunities to talk and engage in what that could look like, what works best, how we can work together, is something that we would want to offer and be involved in. Members' engagement. I think, and I say here, you know, a general invite, come and see our services. Come and have a look at MAGS, have a look at Emerging Futures, St Paul's. Come and see our services, get a feel and get a sense of what the provision is, what we're achieving, what the issues are, and please, any influence that you can make to be on the ICB, on any provider of health, mental health services, the Community Health Trust, anything that you can do to influence that focus on homeless, that focus on rough sleeping, that support for the initiatives and the work that is already ongoing would be really very welcome. We have an open day at MAGS on the 18th of May. Please let us know if you'd like to come along. Might have the opportunity to share a bit more with you then. And national constraints, local flexibility and responsiveness. I think this for me is really important because there are constraints, be it money, be it approach. But what I think has worked really well locally, and Jonathan would absolutely push this point as well, is the collaboration, is the flexibilities that can be brought to bear. Jonathan, I have to say, Tom, wanted specifically to be thanking the housing team from Lloyd, yourself, Rosie. Big shout out to Anaran, who's no longer with us, but was great. The flexibilities, some of the approaches, the opportunity to do things, find a flex which made the difference for the individual and therefore made the difference generally to what we're doing was actually really welcome. My own service lead for outreach commented on our Worcester City Council colleagues. We have a good working relationship with them. they really are prepared to think outside the box to make a difference to what we can do, and that is appreciated. And the opportunity to look at those flexibilities within the constraints, I think, is an important response. I would, I'm sure Tom has seen this, but Delivering Health and Care for People Who Rough Sleep is a report that was produced by the King's Fund in 2020. And I think it's really interesting. I'd just like to finish by quoting from them. They say, we have found 5 shared principles within the 4 areas that they looked at that we think can make a real difference to offering good service around health for this particular group of rough sleepers. Taking steps to find and engage people sleeping rough. Obviously, our outreach, our assertive outreach services, well established now, doing a good job and working together, which very importantly. Build and support workforce to go above and beyond existing limitations, going that extra mile. I was horrified the other day when 2 of my workers described donning rubber gloves and cleaning a service user's flat because he had had an episode. He's waiting to go into rehab. The landlord was about to give him notice. The landlord was going to do an inspection, so the house needed to be clean. And they literally donned rubber gloves and assisted him in cleaning up the house so that he could retain the tenancy, remain stable enough to take up the rehab place in 2 weeks. You know, that's just an example of the way staff will go beyond. Prioritise relationships, building those relationships. That's going to be important for those GP surgeries to think about. These are difficult people. They will present difficult behaviours from time to time, building the relationships with the service user, with the agencies that are working with the service users can actually make the process much more straightforward for those groups if we can build those bridges and tailor the local response to people sleeping rough. It is really about what do we know in Worcestershire, what do we know about what works, what do we know about the agencies, what do we know about the people. You know, to bring that together and flex around what we can flex around locally is really important. And obviously to use the full power of commissioning. Commissioners general, I think that means. So in terms of response, I leave that with you. But if I can just give Tom that reference, perhaps that is something that members of the committee would wish to look at. Thank you.
Thank you very much. And thank you for the presentation. There's a lot in there. There's clearly lots of good things and good practice going on, which is really pleasing to hear. Also some considerable concerns. And just before we go into questions, I think to make it absolutely clear that this committee is not responsible for the commissioning or for the contract of the homelessness service. So, you know, we absolutely hear the messaging and around, you know, the financial position. This is the Health and Wellbeing Committee, so it is about health issues in relation to a population that we know has a huge amount of health needs. So thank you. So open to questions, comments. James?
Chair, thanks very much. Some years ago, one of the things that was a particular concern in this particular area, as it were, was the potential for individuals to fall between the gaps in terms of the various organisations that were providing help and assistance. Are we getting better at that? Is it something that is I know it was on a lot of people's radars and has been for some years. I'm just wondering, you know, is that something now that we're getting better at? Is it?
Yes, I would say it is. I would say that the relationship between the various charities, organisations, agencies has improved considerably. Worcester Cares is a group that's been brought together as a forum for all agencies working with homelessness, and that's an important glue, I think, for the various agencies. I think there was a time when there was that sense of competitiveness running through and between the agencies. I feel that the current group, certainly your officer group through Worcester City, and more widely, the commissioners more widely, and in response to the government papers, have actually looked to, required, and brought together what is a much more collaborative approach. So yes, I do feel much more positive and much more hopeful for what we are doing, what we can do, and what we can still do in the future, even with maybe more restricted resources.
Yes, you mentioned the numbers of the homelessness and how it dropped and now it's gone back up again. In terms of those numbers, are those additional people, have they come into the city because we've got homelessness services that they can access, so therefore that's pushed the number up, or are there new economic circumstances and challenges that have actually put these people into this particular situation? What is the actual root cause of this increase in number?
I'm going to disappoint you in as much as I don't have the detailed account of those 23 and origins, really. But I think it's a combination of those things. I think there is no doubt that Worcester has developed a good range of services for the homeless. But even though we have a good range, as I've said, the demand and the supply is still not quite meeting the requirement. There have been some people that have recently come to Worcester, one family in particular I can think, that have come to Worcester because there was a loose connection with this area. But equally, yes, the cost of living crisis and particularly the threat of tenancies being removed, high rents, people not able to sustain tenancies, issues where people are losing employment and very quickly at risk of losing tenancies. I think there's some research, isn't there, to say that of people, adult people, most living in rented accommodation are probably 2 or 3 paychecks away from potentially being homeless. So there is no doubt that that is a pressure that we're starting to see come through as well. So I think it's a combination of long-standing local people. There are occasionally people who drop into Worcester from other areas. And yes, we are starting to see the impact of the cost of living crisis.
Thank you. As an NHS clinician, I know that the wheels of commissioning can turn very slowly. How confident are you that the ICB are going to move quickly enough to mitigate the factors due to the closure of Farrier House?
We have, I feel that Martina Smith has responded very well thus far. That is not to say that she doesn't understand or certainly does not underestimate the complications and the difficulties of bringing 9 surgeries together and achieving some idea of a consensus for how they will apply their normal rules and yes, their normal rules and processes to the homelessness group. There's a lot going on in terms of information being shared about the agencies, contact points, opportunities that if you've got difficulty with homeless people, speak to MAGs, speak to, agencies that are dealing with homeless people. There's a memorandum of understanding currently being discussed with the 9 practices regarding the prescribing possibility for Nurse Gemma. So again, that's ongoing, but it's not 1 surgery as was Farrier House, it's now 9 surgeries. So I guess we can imagine that that's going to take a little time and there will be different views and that will all have to be managed. So I feel that we have the ear of Martina. I feel we've had, in fact, Simon Trickett. Trickett. I suddenly had another name in my head and thought, no. So Simon Trickett has actually referenced this specifically, and also with Martina, to say that he would wish to see that there could be flexibilities and some way worked through this. So I think it's got the right attention and the right eyes on it, but I don't underestimate it. It is still difficult to achieve on the ground. Our staff are continuing to feedback, to contribute ideas and possibilities, to be a point of contact for practices, and indeed to join seminars. The ICB puts on seminars regularly for practice managers and practices, and again, we're becoming involved in that. And the issue of homelessness and homeless patients connecting with those 9 practices is now coming up in those sort of regular communications with the practices. But yes, I think it's going to get difficult, and we're probably going to come up against it for some of our service users, and we will have to find solutions as we go along. And hopefully there can be flexibility and some flex when it comes to that.
That's a very diplomatic answer, which you know, I think you have to maintain good relations with the ICB, and I commend you for doing so. But the ICB have known that Farrier House was going to close for many months, 6 months plus, and their robust plan is shockingly thin. And I'm interested to hear today the impact that's been having on your service users, who are the most vulnerable in this city. And the ICB's plan was, we don't have a plan really. They called it a robust plan, and their media comms was fantastic at saying how robust their plan was, and without actually giving any details to what that plan was. But essentially it's a free fall. They decided not to save Farrier House, and to let it fail, and had no consideration for the specific skills and services that Farrier House provided, that are not available at any other practice. And I think it could have been done 100 times better. Sad to say, and that's not, I'm sure, through any lack on the Mags or St Paul's or anybody else advocating for provision of these services and a plan, but the ICB just didn't do it.
It is difficult. Farrier House was indeed a safety net within Worcester City when it came to physical health need for our service users. We still have the health hub in the day centre. Nurse Gemma will be coming to the health hub. I don't think we're going to see the doctor there in the same way that Dr. Brennan would present himself. We will obviously we will make representations for our service users, we will support, and we will make sure wherever possible that we can link people with primary health care. But of course it is significant and it is necessary. And for our service users, they of course are often the group that will slip between the cracks. And this is certainly a crack for us. But as I said, at the moment, Martina and the ICB are engaging wholeheartedly with us to find solutions, and we want to embrace that at this point in time. But we are keeping a note, and we are feeding back, and we are ensuring that the reality of the situation is clear to those that need to know of it.
Thank you. Yeah, certainly, I expressed considerable concern. I was first informed at Christmas time that Farrier House was going to close, and those of us that have been around and connected with health services in the city for a period of time, Farrier House was set up as the substitute for the walk-in centre, and many of us thought that closing of the walk-in centre was a huge mistake in terms of service provision for the city. So Farrier House, and that being where the homeless population could go was a really positive thing. So for that now to be going is hugely disappointing. And when, when I was given the information, say at Christmas time, it was confidential at that point because the staff hadn't been informed. But, I gave feedback straight away in terms of concerns about this particularly vulnerable population and how are they to be communicated with. I gave a list of questions and was somewhat disappointed by the answers from the commissioners, to be honest. People who don't have a fixed address, you cannot send a letter to. People who don't have a mobile phone and access to electricity, you can't send a text message to. And I know that some of the practices within the city are paperless. They do all their communication in those ways. So it's interesting to hear, a bit more of the detail of how it's panning out. So the fact that there are now other surgeries that don't have experience of the health needs of this particular population is really, really worrying. As chair of this committee, I'm a member of Worcestershire Health and Wellbeing Board. I think we did raise it there, and I'm happy, not happy to, I will raise it at any other sort of forum possible. What we are where we are, as they say. What would be your kind of top ask? What is it that would make the difference now most? Because I'm really worried, that this people will fall through the gaps, won't they? They won't get the appointment time. They'll go into the practice and their behaviour may or may not appear acceptable to people who aren't informed. And there's what is the level of risk of people completely losing access to healthcare, and what can we best do about it, do you think?
I think that is a concern. As I say, we're 3, almost 4 weeks now since the closure, so it's still relatively early days, but we are starting to see people dropping out from registration from the other surgeries. There is no doubt that key in terms of what worked well with Farrier House was that relationship between the reception and the basic administrative staff in the surgeries and our staff and our workers. The idea that communication should only happen through the patient is understood, but the flexibility of ensuring that if appointments were missed, that our staff were informed and could intervene is absolutely just a basic but very practical thing that would make such a difference. So it's about relationships between the practices and MAG staff, and indeed other charities and their staff as well. Communication and the willingness to share a minimum level of communication, just what is required to assist that bridge for the service, our service users, their patients, to retain that connection with the care, with their primary health care provider. I think that's absolutely key. Obviously, we're talking about a very chaotic group of people. Even the proximity of our day centre to Farrier House was not always straightforward. Hence Dr. Brennan and Nurse Heidi, Nurse Gemma coming to the day centre was important. So yes, I think proximity, the range of surgeries, the idea that if one drops a service user, they'll have to connect with another one, and what that says in terms of building a relationship, service user as patient to the surgery. It gets complicated. It will be devastating, I think, if we get to the point where our service users are allocated to tier 2 service, because there is no way, I think, that our service users will routinely or could routinely access primary health care from Bromsgrove. That would be most unlikely. So yes, relationship with between the surgeries and the charities, the agencies actually working with homeless people is an important point of contact that needs to be worked on and developed. As I said, there was back in 2018, the paper by the Public Health Group, I think Health Matters or Health for All, actually is an excellent paper talking to GP practices about how you engage with this service user group. In some respects, I think we need to pull that out, dust it down, and get it out there to the GP practices and start a conversation and an engagement around what Farrier House knew and learned over time, and some shared learning there with the GP practices about how we can make this better from here. It's not ideal. I'm sure they're not happy to be having to accept our service users, but I think it is as it is, and we now need to work on what we know can make a difference and don't lose that connection and those bridges into primary health care.
Yeah, thank you. I mean, Worcestershire has a health strategy in place that has overarching theme around health inequalities and prevention. And I think what we're seeing here is, if you like, I hesitate to say a failure actually to deliver those aims for this particular patient group. So yeah, I mean, anything that we can do to improve or assist matters, and information that you want to share, we will endeavour to do so. And I guess, I mean, I hope colleagues are in agreement whether we kind of formally put on record our concerns about this, and it may be helpful, for you to come back, say in 6 months' time or whatever, to actually review the up-to-date position and how it's panned out. But yeah, there are very practical things that thank you for sharing, and I hope we can find a better way forward. And thank you, to you and all your staff for all the services and the care that you provide. Thank you. So the next item on our agenda is proposed committee performance scorecard. Is that down to you, David?
Thank you, Chair. Good evening, members. The report before you is a report for consideration. There's two elements that we would ask you to consider. One is a proposed revised approach to corporate performance reporting across the organisation, and then more specifically for this committee, there's a proposed scorecard for 24-25. So currently, as you'll be aware, we have a one-page overview that comes quarterly to committees, which picks up key priority activities, projects and actions, and also the key performance indicators. And that's reviewed annually by CLT and members through the committees to make sure that that's reflecting what matters most to the functions of the committee. However, there's a new Office for Local Government, sits within DLUC and is developing a new approach to measuring council performance. And Oflog's activities will present local government performance, celebrate success and help others to learn lessons from that success, and importantly identify local authorities at risk of potential failure. And Oflog have developed an online tool called the Local Authority Data Explorer. Currently there's waste management, planning and corporate and finance elements in that which are relevant to this council as a lower tier authority. So taking that into account and the new national measures, the preferred option at 3 is that we adopt those Oflog measures as our own, those ones which are relevant to services provided by the council. Most of these are already collected, actually as part of our existing processes, or very similar to those currently reported. They are annual figures under the Oflog Data Explorer. The proposal here is that we produce those quarterly internally to give us that early indication of any issues. The purpose of the Oflog measures is to provide an organisational level view of performance. So the proposal is that the full set would be reported to Policy and Resources Committee as a corporate scorecard. and that would replace the current KPIs that report to each of the individual policy committees, with the exception of income management, for which there are some very specific income PIs, which are very relevant for income management subcommittee. There are some gaps in the off-log metrics at the moment, so local PIs will be included within that corporate scorecard to Policy and Resources Committee, and I think housing would be an element that at the moment is not represented. And the proposal is that where there is a cause of concern, is decline in performance or a low rank amongst our nearest neighbours, then Policy and Resources would refer those to the relevant policy committee for review and to identify an action plan, and that policy committee would then monitor progress against an improvement plan. And the proposal is also that the committee, this committee and other policy committees continue to get the quarterly reports of the activities and projects as now. So there is a proposed health and wellbeing scorecard at Appendix 2. In addition, where there's specific measures that are needed to establish a baseline or monitor performance against a particular project, those would be developed for the various policy committees. Otherwise, it would be Policy and Resources Committee that would receive the detailed PIs. Just taking you to section 4, the alternative options considered. The KPIs that we're currently taking through policy committees are largely local and locally defined. They're not consistent with collection reporting methodologies used by other authorities. And I think that's reflected across lots of other authorities. It's not just Worcester City that has its own KPIs. So that makes benchmarking quite difficult or not really possible to do that effectively. And we've got 200 KPIs across 6 committees. So the view is that that's not really a clear corporate view of the council's overall performance or corporate priorities. And of course, the current arrangements don't take account of all of the off-log metrics, and it would be in the council's interest that we have an early sight of those metrics quarterly before we get to the end of the year, and they are published nationally. So what officers are asking the members this evening is that you consider these proposals, and we will come back in June with proposed scorecards as we normally would in the cycle, but I'm happy to leave it there and take questions, Chair, or for members to discuss.
Thank you very much. Open to questions and comments. Neil?
Thank you, Chair. Thank you, David. So I'm going to essentially repeat a comment I made at Communities Committee last Wednesday, because I know it's been going to all committees, and I'm going to add a new comment. So the comment I made last Wednesday, one of them was about 4.1 and 4.2. Says that the current performance measures make it difficult to benchmark. Well, we're a local council, and I think, as I said Wednesday, it's good that we have our local performance measures because they relate to Worcester, the city. They're not an identikit set of measures that are applicable to all councils. And I think benchmarking is potentially code for keeping a check on councils. You know, we are Worcester, we're not an extension of Whitehall. And I had hoped that that soundbite would make the Worcester news, but it clearly did not. Second bite of the cherry. 2.3 says offlog was launched in July. Sorry, for the purpose of people who are listening, hi Mum. Offers for local government, offlog, was launched in July 2023 with a vision to provide authoritative and accessible data analysis about the performance of local government and support its improvement. One thing that would support the improvement of the performance of Worcester City Council would be to give it adequate funding. Instead of introducing a set of measures to so-called benchmark what we do, in a few months before the government's going to fold anyway and be replaced by a new one. So I'm a bit miffed by this, as you can tell, because it's a new system introduced by government in its dying days. It seems like the equivalent of an Ofsted, which no one likes. The performance targets that I've been looking at for the last 12 years, yes, there might be 200 of them, but they're local and they tell us how well we're doing. And finally, is this being imposed upon us and we're just sort of looking around the edges, or do we actually have a say, and can we reject this? So 3 comments and a final point is a question. Are we just rubber stamping this? Do we have any say over this, or is it going to happen anyway? Thank you.
Do you want to pick up the point of we are obliged to do it or not? Because that's a fundamental point, isn't it?
So to answer your question, this will be a national indicator that will be nationally reported. These measures are collected by councils and reported anyway in various different forms. So they will be published, and they will be published nationally. So we are required to be a part of that.
Thank you for the report. How successful is Oflog so far?
I don't think that's really a question for me to answer.
It's very new, I think, is the short answer. It's less than 12 months old as a concept. Yeah, it remains to be seen. Sarah?
Thank you, Chair. I actually welcome this. I think it's a great approach to have. Performance measurement is essential. We are elected onto this council, and somebody needs to be able to measure how well we are running the council that we're running. From May, we don't know what the council is going to look like after the May elections. And I think it's essential that the public can see at a glance how the council is achieving, so that they can make their decisions going forward for future elections. So whilst it might seem like another layer of bureaucracy from the government, I also welcome it for the public to be able to see how we're doing. Thank you.
Yes, during the noughties, that decade, that almost 20 years ago, I was chairman of the Performance Management Committee, which looked at all of the performance indicators across all the council services, and we used to have quite a few national indicators that we had to actually have, and those were taken away when the coalition government came in, and actually some of them were a bit sort of meaningless, but we had to record them anyway. But some of them were actually quite important, and we had like a group of like similar councils, for example, like Exeter, Gloucester, Carlisle, and that, where we could actually compare ourselves in terms of our actual service provision in that. And I think, it is important that we actually do have this. And I think that whatever happens come the next election, I think this is something, whatever future government will want to actually build on, because it is actually a sensible thing to do. And we can't always rely on marking our own work and saying, how well we've actually done. The caution I would say is, hopefully the ministries will not actually set meaningless indicators that take a lot of officer time to actually compile, but will be things we can actually see. And it will be interesting to see how we do against Exeter, how we do against Gloucester, how we do Carlisle and Lichfield, all these sort of similar sort of places to Worcester. And it'll work in a number of ways. First of all, hopefully it'll help to drive performance up, because because I think, you know, knowing what good performance is, and also it will also tell government as well if there are certain groups of similar authorities, settlements, that are all having similar types of problems and that strengthen the case for their sort of, you know, extra resources and things for those particular authorities. So I think it is something, I think the committee, I think we should actually welcome, because, you know, at the end of the day, what we want to see is, you know, better services in this council area and across other council areas as well.
Thank you, Chair. I mean, I guess in terms of the actual kind of off-log metrics, it's a moot point because we have to do it. The question really is, you know, at this time when you know, officers are having to change their way of reporting because of off-logs requirements, you know, what other changes do we put in place to ensure that measuring stuff is not overburdensome, but also I think to look at, you know, it's an opportunity to look at how we monitor not just the activities, because a lot of our indicators are just pure activity based, but you know, are we achieving, if you like, the objectives of a local authority? And I don't think that off-logs metrics do that at all. My concern about them is that if we start then looking at them as targets for us as a council, that it becomes a pointless exercise. You know, it's a well-known law. I forget who it's named after. That a measure that's made into a target becomes a poor measure. It stops measuring what it was originally measured because you've made it into a target. And there are so many other ways, methodologies for actually looking at, you know, things that matter to people. Meaning, you know, this is a health and wellbeing committee, so you know, any of the actions that the council takes can have an unexpected impact, either good or bad, on the well-being of the citizens of Worcester. And how do we monitor that, which is what actually matters to the residents, is their well-being and the well-being of the environment of Worcester. So my thought, looking at the fact that there's a sort of an upheaval going on, we need to change the way that we're counting things. Is can we use that and as an opportunity, a springboard, to buck the trend and not just go use these sort of blunt instruments of targets and activity measures. The Health and Wellbeing Committee, maybe that has a very specific mandate to, as an overarching, theme, which is the well-being of the residents of Worcester, to specifically, look at that. And I don't know how that would happen. Whether, obviously it's not something to be sort of negotiated and looked into in a committee sort of scenario, but maybe we can take it forward with like a task and finish group or something like that to actually look at how the Health and Wellbeing Committee can progress the way that we actually monitor ourselves, so that we're not just creating a stick to hit ourselves with, or for central government to hit us with, but actually having meaningful things for the residents.
Just 2 points. I want to clarify that I do think performance monitoring is important. I'm not saying it's not. The point was that we already have local and specific ways of measuring how well we're doing. So I'm not against performance management or monitoring. It's about you know, it being top down, this is the system, and which is probably not fit for purpose anyway, because it's a blunt instrument being applied to all councils. And if we want better services, we'll achieve them through having better funding, not spending more time on gathering data to appease people in Whitehall. So we already look at our performance. It's local to Worcester. But I realise that I'm howling at the moon here because it's being imposed upon us anyway.
Yeah, thank you for all those comments. I think to come back to the paper that we have in front of us and the recommendations that we have here, however much we disagree with the creation of the new Office for Local Government, it does exist. And I, as leaders, we were invited to a webinar, so heard the chief exec explain some of this. The data that they are looking at is data that they are drawing from public places. So it isn't that our council is putting a submission in, it is being taken out from documents that we have to publicly, that are in the public domain in other places, so that they say they're not adding a burden. They will be collecting this data, they are collecting this data, it will be published. And I think the first edition of the Data Explorer is publicly accessible now while it's still being refined. So the data collection will happen. With regard to the implications within the City Council, I would absolutely agree that if our council is being measured and compared, is being monitored on those metrics, then it is important that the Policy and Resources Committee has sight of those metrics so that we have somewhere that we can see if on those metrics you know, we are behind others, there are any in the red zone, or actually we're doing really well. So I think that's part of the recommendations. I don't know whether, you know, just to kind of sign that off, are people around the table, we, like I say, content with? We can disagree with the politics of it, it is there. So we're happy that the off-log metrics go to Policy and Resources. That then completely begs the question, because there are absolutely no metrics with relation to health and well-being. However, other parts of the government system and local health and well-being systems do have and are collecting metrics. So within the health and well-being plan, within public health, you know, we get an annual report here from public health who come with lots of data and information, and down to city council and lower super output areas, so smaller areas than a ward boundary. So those metrics we do see and we do have sight of. Looking at the performance scorecard that we've had in place this year, I think we would, personally, I think I would want to continue with a number of those measures, presuming that they are ongoing projects. But I think to have sight of the number of discretionary welfare assistance scheme claims and awards, and actually what those requests are for, is a really important performance measure that I would want to keep sight of. And again, around the, you know, monitoring elsewhere. So other parts of government, the Department of Health and Social Security are monitoring what integrated care systems are doing. And one of the things that they are keeping track of within that is the amount of money that is put into what's called the Better Care Fund, which is where there's some money from local government and some money from the NHS put into the pot together. And with regards to ourselves, our key use of that is around supporting people to live independently, isn't it? So the, I've lost the word, what's it called?
Contract.
The
Contract, promoting independent living.
Yes, so it's around promoting independent living, disabled facilities grant, that's what I was trying to think of. So that is an expenditure that we have, and to know how many people have been helped with our share of the disabled facilities grant is something that this committee or within here or within communities, it kind of sits partly between the two. Those are important measures. If the, I mean, looking at the KPIs, there are some there, I think, that are sort of projects which are coming to an end, or the period of funding was coming to an end. So the young people referred into the one-to-one walk and talk, I'm not, if that is not continuing, maybe that is one that we could drop. Certainly the principle of not putting extra burdens on officers is really, really important. And I think, you know, where our resources are challenged, we need to be really mindful that the most important resource we have is our officer time, and to make sure that that is used to the optimum, rather than just counting things, but we also want people to be able to do things. So is there any further comments at this point? Okay, so I think we kind of agreed that the off-log measures should go to Policy and Resources Committee there, and then if we could ask officers to review the performance scorecard that we've had at this committee for this year and look at ones that could be dropped off the list. But I think quite a number of them we would want to, if they are continuing projects, we'd want to continue to monitor them into the future. Is that okay? Yep.
Yeah, thank you.
Thank you. So that will come to the next Health and Wellbeing Committee following the elections in June. So moving us on then to Worcester City District Collaborative, and this is actually the illustration of what we have been doing locally in terms of working between the City Council and health services.
Thank you, Chair. So this report intends to set out the work undertaken by the District Collaborative in Worcester since the last update was brought, I think it was July last year, and to help inform members of the focus of the group moving forwards. So district collaboratives are place-based partnerships formed by organisations for delivering health and care services in a locality, and are one of the foundations of the integrated care system arrangements, which acts as a vehicle for delivering the City Council's health and wellbeing priorities, as well as those set out in the Worcestershire Health and Wellbeing strategy. The priority focus areas of the collaborative for 23-24 are tackling loneliness and social isolation, with key benefits focusing around the preventing of early onset dementia and diabetes, providing the best start in life during maternity and with children's health, with some key benefits including reducing childhood obesity, tackling anxiety in young people, as well as providing better physical and mental health outcomes in later life. And then the third area of priority was around tackling inequality and deprivation linked to health outcomes, with a key benefit surrounding access to health checks and screening for prevention and early diagnosis of illness. So the Worcester City District Collaborative has had a programme manager which has been in post since July 23. That's funded through a public health grant from the Being Well Fund. That role has been integral in driving the collaborative forward, providing coordination of work, working with each of the partners that sit around the collaborative to really move things forward. So it's been a big benefit to the delivery of the district collaborative priorities. On-site advocacy have continued to deliver the project surrounding mental health support in schools. This complements the existing county council offer around mental health provision in education settings. A whole family approach is taken to providing support, so although it's accessed and focused around the young person, a whole family approach is taken, and that's kind of in recognition and indicative that what might be presenting for the young person may be as a result of wider issues in the household. So the two posts that are delivering this provision by on-site are funded by the council from COVID reserves, and what we're seeing is that the uptake remains high. It's been growing quarter on quarter, and that's largely because the services become embedded within those education settings. So the collaboratives continue to meet regularly, and the work with regular attendance from all of the partners from around the collaborative. In addition to the standing agenda items and focusing on the three key areas of work, the group's also received a range of presentations from wider partners and wider stakeholders. So that includes the review of the DWAS scheme, Beryl Bike scheme, warmth on prescription, as well as a public health presentation on reconditioning. So part of the role of the collaborative has been around sharing good practice within the city and making sure that services are aware of what provisions are available. So the three work streams. The Providing Best Start in Life work streams focus on three areas. Firstly, the Healthy Start, which is the initiative to try and increase the number of eligible families accessing Healthy Start cards and vitamins. So in order to try and increase access to the scheme, free for members of the public that are eligible, a coordinated social media campaign was undertaken. So that was done through the collaborative and with each of the partners, using promotion, briefing frontline staff, and trying to raise wider awareness of the Healthy Start provision. And that's something that we're hoping to be able to measure the impact that had. Reducing child anxiety. So the groups identified what current services are in place, the gaps and opportunities for collaborative working. The on-site advocacy project that I mentioned is contributing to the delivery, but there's still work to be done, and is an ongoing piece of work. And then better physical outcomes is the third area that work stream has been focusing on. And it's focusing on looking at increasing physical activity, particularly around 0 to 5-year-olds. So that is very much in partnership with some of our partners, Freedom Leisure, Active Herefordshire and Worcestershire, and will surround a campaign to encourage families, particularly around holiday periods, to access physical activity. Tackling Loneliness and Isolation workstream has been looking at improving recording and awareness of loneliness and isolation. So one of the key challenges around loneliness and isolation is trying to find people that are experiencing those issues. By its nature, they may not be accessing services, but where they are, record keeping can be improved. So when they're contacting agencies or GPs to try and identify ways that we can better capture where somebody may be at risk or is suffering from loneliness and isolation, so that it can inform how we move forward and how we deliver services. The work streams looked at working with the voluntary sector to understand community health and the barriers to engagement. So we're looking at arranging some research through the VCS Alliance to better understand what the barriers may be. And then a consistent referral process through rolling out training to frontline staff. So it's recognised that it's not necessarily universal awareness of what loneliness and isolation is, or how to report somebody that may need additional support. And then the final work stream focused on health and inequalities. It's quite a broad area of work. So what's been focused on is around health checks, and particularly the low take-up of health checks in IMD 1 and 2 across the city. So some of the most deprived areas where the take-up of health checks is particularly low. So again, what we've tried to identify is something that's measurable, so we can understand the impact and what difference this focus might be having. So we've been trying to identify the individuals not taking up the option of health checks, try and understand the reasons why, what the barriers might be, and utilising wider partners, so utilising members of the voluntary sector who might be able to help sort of break down some of those barriers, as well as utilising the county council Your Health, Your Wellbeing vans, so recognising that people won't necessarily always come into services, so very much taking the service out to communities and targeting areas where we know take-up is low. So I think it's fair to say that the District Collaborative has a very strong commitment from across agencies operating in the city. It is chaired by the District Council, but it's very much a partnership meeting, and I think that's really well recognised. When we hold it in this room, it's completely packed, and that's been the case since its inception, so attendance hasn't sort of drifted off and people haven't lost interest. There's a lot of commitment around the table. In fact, we've struggled to retain the membership to make sure it is focused, so hence as having stakeholders come for individual sessions rather than continuing to grow the membership to something which is unmanageable. So in January this year, we received the presentation at the District Collaborative on the Worcester City Joint Strategic Needs Assessment. So that came to this committee also. So that identified the priorities within the city surrounding health and wellbeing. In January, we reviewed the priorities for the District Collaborative, and actually from the findings of the JSNA, the 3 priority areas that we've been focusing on over the course of the past 12 months remain still very valid and will remain the priorities moving into the coming year. So yes, we'll be remaining the focus on the 3 priority areas, but we'll also be using the data from the Joint Strategic Needs Assessment to help inform particularly the red indicators that were highlighted through that assessment to inform the Collaborative's action plan. So what we want to hopefully see next year when we have the presentation around the JSNA is some positive movement on some of those key performance indicators. Have to stop there.
Thank you very much. A summary of a lot of work and a lot of conversations. Comments or questions? Neil?
Thank you, Chair. Thank you, Tom. There's obviously a lot of good work going on in a very difficult, wider context, which was made very clear by Matt Fung from Worcestershire County Council at the previous Health and Wellbeing Committee meeting. He gave a very impassioned presentation, spoken particularly about target number 3 of the collaborative, which is targeted engagement where inequality and or deprivation is linked to health outcomes. Basically what Matt Fong said very eloquently over a 25-minute period was that if you're poor, you're going to be less well. So it's great that this collaborative exists to try and plug the gaps that have been created by national government over the last 14 years. So that's the political comment. The question is about the funding of the programme manager. So they get £75,000 of Worcestershire County Council public health funding for 2 days a week until 2025. Can you say a little bit more about what the £75,000 for that programme manager is going on? Because if I was a member of the public looking at this report, glancing at it, I'd be like, that's a lot of money for one person's time when it could be spent helping families who are in need. So is there more detail on that that's able to be shared tonight?
Through you, Chair. I mean, I can provide probably further detail after the committee. I mean, in terms of the roles, it's over a period of time, so that's not an annual cost. I think it was a 3-year, 2-year or 3-year post. Yeah. So the purpose of that role is to drive forward the agenda of the district collaborative. So whilst it has got very strong engagement from across the partnership, it does require driving that forward. So without which it doesn't necessarily have a sort of dedicated lead. So I'm probably not articulating that particularly well, but it has certainly been really important in driving forward the work of the collaborative and bringing it together. And I have no doubt that without which it may not have achieved what it has done to date.
Thank you. Although I'm not a mathematician nor a statistician, can't even say the word. It's too late in the evening for me. But surely that still equates to quite a lot of money for one person, even 2 days a week over a 3-day period. So I appreciate you saying after the committee you can give more detail. If there's anyone watching this and anyone read the report, I think they want to know, preferably within the committee meeting, where that money's been spent. So I'm personally happy to receive the information later on because it's about one individual, but I still think it's a lot of money to help people who have no money or very little money.
I mean, my understanding is it's the amount of money that was given by the county council to the district collaborative, and it was the decision of the district collaborative to use it to support a part-time officer. I hear what you're asking. Given that it is an individual that is employed by this council, it feels as though we're actually probing what she is being paid, which I'm not sure is fair for comment within this committee. But how that money was spent was a joint decision of the district collaborative, is my understanding. And for clarity, as chair and vice chair of this committee, we have an invite to every district collaborative meeting. I don't get to them all, but I have attended quite a number of them. James, I've got you next.
Chair, thanks very much. Tom, 3.8, where we're talking about those people referred to the on-site support workers. Now, if, as the report says, a number of people with quite complex issues are initially thought to have either mental health or well-being issues, that's then dealt with at that level by by people who have got specialist knowledge of those particular areas. Once it's then, you know, and acknowledgement straight away that there's a difficulty in untangling some of the things that you know, initially might present as mental health issues or whatever. How successfully is that rather sort of informal triage system, if you like, then in you know, once it's begun to become apparent that those people have actually got other issues that other people with more specialist knowledge in those. What I'm sort of driving at is how successful is that once it starts to flow through the system, you know, in terms of engagement with individuals who may then be able to intervene on a more sort of specialist level.
Yeah, I mean, Onside are very experienced at of delivering support, previously provided social prescribing and have a very good understanding of the provision of a range of services that are operating across Worcester and are very well connected. So where there's a need identified which can be better met through another provision, then referrals would be made through to them. So I don't have any concerns about where other issues may be identified that there is that those referrals aren't passed through. I suppose the biggest challenge is probably around the extent of the provision that's available, and particularly where it is surrounding more complex needs. We know that demand for the service is high. The Onside provision that is funded through the City Council is within 4 education settings. So the County Council do fund provision elsewhere within the city and across the county. So this is complementary to the provision that's delivered by the County Council. But what we do know is that within each education setting there is significant demand around this type of provision. And where there's a greater need, then we know that there's demand for those secondary services where more specialist support might be required.
Thank you, Chair. I used to be the project coordinator for children and young people's mental health, improving access to psychological therapies in Herefordshire. And I worked for a collaborative of the NHS, the local authority, and the voluntary sector. So I can attest to the fact that the mental health needs of young children are extremely complex. They might present as anxiety, but when you delve a bit deeper, you find there's actually been trauma, there's all sorts of things going on. We used to have a really lengthy questionnaire. They'd be referred to us by a GP with one presenting issue, but when we dug deeper, they could be up to 30 presenting issues. So I can attest to that. And what we was saying back then is that for every £1 spent on children and young people's mental health, you're saving £3 in later life on adult mental health services. So the work you're doing is essential, and it's just so important, you know, that adverse childhood experiences that often lead to these anxieties have a knock-on effect in later life and will affect physical health as much as mental health. So it's so important that you're addressing this, and thank you. Thank you for the work you're doing.
Thank you, Chair. Thank you, Tom, for a really comprehensive report. And I'm so pleased to see that holistic and preventative strategy running through everything rather than the historic reactionary, sort of approach that we used to take. For each of the priorities, there is quite a heavy reliance on the BCFSE sectors. How resilient and healthy are those organisations in Worcester at the moment, given that lots of them have faced quite significant reductions in funding. They're all scrabbling around after the same grants. So my slight concern is that we're sort of pinning all our hopes on the ability of that sector to deliver, and actually they might not have the capacity to be able to fully support the priorities.
Yeah, really valid point, and there is a really strong VCSE provision within Worcester and across Worcestershire, in fact. It's probably how the report's phrased that we're not necessarily reliant on them to deliver, so we're not trying to put undue pressure or expectation on them. I suppose the way I would phrase it or focus it is around capitalising on the voluntary sector and what they can bring. So often, and it could be any sort of strand of that. So it might be faith-based communities if we need support in accessing a group that may not be engaging. So it's using the assets that we have within the community to the best of the ability, rather than putting additional pressure or expectation on them. So it's slightly different. Maybe that's not conveyed accurately within the report.
And it's probably worth saying that a number of charities actually are commissioned to provide services, are contracted to provide services. So, that is part of the reason that a number of those organisations are around the table. I've got Steve next.
Thank you, Chair. Yes, thank you for the overview report, Tom. It's given us sort of a good general understanding of the work of the district collaborative. What I'm interested in specifically is, I guess, more the city council's role in that in two ways. One is, what, I suppose, action points come out of those meetings for the city council specifically, but also, which is perhaps difficult to write in black and white, is, what, apart from the chairship, does the city council bring, if you like, to the collaborative, which is a bit of a sort of qualitative thing in, like, how, as how you could report on that, I don't know, but and sort of linked to that then is, these specific areas which are, I think obvious to us that they are really important, would involve, numerous different areas of Worcester City Council potentially, housing, communities, all sorts. So what's the mechanism for ensuring that, if you like, the discussions, the information shared between partner agencies is disseminated down to sort of the ground?
Yeah, really valid point. I think one of the key roles of the district council has been, what's the right way of putting it? Not quite ambassadorial, but to help provide the sort of platform and to get that engagement from other providers. What we didn't want it to do from the offset really was for it to be a council-led meetings that can, can have certain connotations and set a certain tone and context for the meetings. So it has been, we've really focused on that, trying to be a partnership approach. So within each of the three themes, each one of those is led by a partner, so another agency or agencies collaborating together as the lead, and we've been providing some support or attendance as the city council to those to each of those sort of working groups. So we haven't committed to leading everything and driving everything forward and taking ownership or responsibility of the whole agenda of the district collaborative. It's been attending where it's required and to help moving things forward. In terms of our role, I mean, it has depended on the nature of what we've been looking at that specific time, but certainly around our ability to access and engage with the community has been really important. So certainly looking forward, the role of our community engagement officers, understanding what assets are in the community and how we can access those, as well as the sort of contacts that we're able to bring, has been both important to identify where to deliver provision, where to sort of attend, as well as who we can bring into the conversation on that specific issue. So when we've wanted to go out and do utilise the van, we've got local knowledge around where it's best to even to the basics of where to park it and how to sort of position it to try and get that best engagement. So, but I think elsewhere, when we take things back, so things like presentations are shared internally with relevant parts of the council. We obviously try and keep members updated in terms of bringing things to committee. So we try and create that. I mean, it's been a key focus of the collaborative is that information is shared across organisations, but also within organisations. And it's been quite interesting just to get the breadth of what service provision is out there, and focusing on that on just 3 areas has really helped to sort of hone in on those priorities.
Thank you. And I mean, just to add to that, the services and the facilities of the council have a really important role in health and well-being. So, the leisure services, the sports centres, the parks, the green spaces, those are assets, if you like, the city council specifically brings to the table, and the nature of a collaborative, certainly what I've observed is genuine, working across organisations and helping people round the table deliver on the agenda and the priorities in quite practical ways, isn't it? I've got Katie next.
Thank you, Chair. And it's really only a comment on the next step section. Thank you so much, Tom, for leading us through that report. It was just so I had a chance to say I'm really grateful to hear that at the next meeting we'll hear from the Worcester City Council play plan, because playfulness and play spaces are not frivolous. They're absolutely essential to the health and well-being of young people. And so it's fantastic to see it there. Lack of play in children's lives has been linked to serious decline in children's mental health. So it's brilliant. I'm just expressing my gratitude. Thank you.
Thank you. And then Stephen.
Thank you. Yes, I know I've been to a few of these district collaborative meetings in my role as vice chair of this particular committee. And what I would say is it's a real eye-opener, because you realise the amount of organisations and the amount of activity that actually goes along this. And if you could produce a event chart of all these particular organisations, there's a lot of overlap in that, which is actually in a way really, really good, because it means people have more than one agency to actually approach for. And the impression I get coming along to this particular meeting is it's a great network opportunity for members of these various organisations to actually sit down and chat and actually things really do come out of this particular meeting. I think you explained it really, really well, Tom, about how our city council is actually important in terms of this, and in terms of how Lloyd facilitate these particular meetings as well. And I think this is probably one of the best things that this council done in recent years, is to actually establish a health and well-being committee, and these things are sort of following afterwards, where now the district authority is now taking a far bigger focus in this particular area, whereas under the old system, when we just had the communities, health and well-being was a sort of just a byproduct. Now it's really coming into itself with this council.
Thank you. So committee happy to note the contents of this report, and it is part of the City Council's role in health and wellbeing. So thank you, Tom, and thank you to all the officers involved in that work. Agenda item 8 is Child Poverty Task and Finish Group, and where we've got to with that.
Thank you, Chair. So this is actually the 5th update report that's been brought to this committee surrounding the recommendations identified within the Child Poverty Task and Finish Group. I think back in 2021, I think the recommendations came out. So it's intended that this will be the final report in respect of these recommendations, with the final piece of work seeking to be closed. And the last recommendation outstanding, which can now be discharged. So the final recommendation surrounding the consideration of whether any suitable council land and or allotment space could be used to help address food poverty. The council provides over 1,000 allotment plots of various sizes across 23 sites that it manages, and there's a further 4 sites which are privately managed. We've had a lot of feedback in recent months surrounding the allotment service, and it's intended to review the role that the council plays in its provision and management over the course of the next financial year. We're hopeful that this will give a lot of opportunity for the council to engage with plot holders, site coordinators, to discuss shared priorities, and one of which will be around how allotments can help to support food provision, particularly in some of our more deprived wards. In addition to growing food for consumption by themselves, their families and friends, what we understand, at least although largely anecdotal, is that plot holders also often provide produce for use within the wider community. An example is at Purdeswell allotments. They've now set up a community garden, and across this and their main plots are actually providing fresh produce to Worcester Food Bank. So a practical example of that in action. So publicly owned space, green space in Worcester is managed both for the wildlife, for public access, as well as recreation. That includes local nature reserves, wildlife sites, parks, as well as verges, hedgerows across the city. Some examples of those locations are outlined in section 3.6 of the report, and there can be an abundant source of natural food sources. So picking a small amount of fruit on your own for a non-commercial use is acceptable. The council have a fruit picking policy, so long as trees and sensitive habitats aren't damaged. So again, a sort of practical opportunity that council land can be utilised in that way. Council officers, as well as volunteers, have supported the planting of fruit trees across sites across the city, and will continue to support opportunities to enable food production on council land, as well as consideration of sustainable food production as part of our commitment to our environmental sustainability goals. We've also provided direct financial support to a range of organisations whose role includes the giving of food. It's included small grants to community groups via the community grant scheme, larger grants to the food bank, food vouchers through the discretionary welfare assistance scheme, and recently supporting the provision of a community fridge at Dines Green, which was approved through this committee. So although it's recommended that the recommendations of the Child Poverty Task and Finish Group have been discharged, it is important to note that through the work of the Health and Wellbeing Committee, the Healthy Worcester Group, and the Worcester City District Collaborative that I've just been talking about, that child poverty will remain a key area of focus for the council, and also for these groups that it's represented on.
Thank you very much. Questions and comments? Elaine?
Thank you, Chair. I've got two questions, if I may. The first one is I looked at the live feed for the allotment allocation today on the website, and it still shows that there's quite a lot of vacant plots, even though there are waiting lists for each of those areas. So I'm interested in sort of what is the turnaround time that those allotments could be released to people on the waiting list. And then my second question was about the recommendation to use suitable council land. The Newtown Green Community Group have tried to do this in the past because they identified an area that they could use with the preschool children to grow, but because that area had to be fenced off, then there was some cost implications. So I don't know if there's any, for people who are willing to grow some food, particularly with the local schools, is there any support that would be available through existing grants? I spoke to Nunnerywood Primary School today, and they've got lots of raised beds that are currently not being used. They can source the seeds, but they haven't got any soil. And you just think, for something that seems so easy and straightforward, have we got any soil anywhere that we could give to the school for them to be able to plant food with the children that they could then redistribute across the school, the families in the school who may need it?
Unfortunately, I'm probably not going to be able to answer your questions very, very well. In terms of the vacant plots and allotment sites, I'll have to take that question away in terms of waiting times and what that looks like. Whether it's the localities of those, I don't know, so I'll have to come back to you on that question. I mean, we do have the community grant scheme, which has been rolling for a period of time. The allocations for next year's grants has ended, so it's been open for applications over the past 6 months or so. So that has been fully allocated for the coming year. Hopefully we'll be able to extend that, but that will be subject to consideration moving forward. So in terms of whether we've got any practical abilities, we do have the grant provision. Whether we have soil and practical things that we're able to offer, again, I'd have to take that away to see if that's something specific that we were able to support with. But you're right that sometimes it's very small and practical steps that are required to make quite a significant difference. So if it's not something that we're able to financially support or practically deliver as a city council, through our work with the community engagement team and understanding where we might be able to help that organisation to access funding or to access support, that's certainly something that we will be able to help with.
Okay, thank you. I'd certainly like to put on record my thanks to the original Task and Finish group that did this work and the officers with them at that time. Now, it absolutely shone a light on this problem within the city, which has, a huge impact on health and well-being for life. And they, were able to take a really practical approach, and it has delivered practical improvements to people who are struggling with the cost of living within the city. So thank you to everybody involved in it. I think it's happy to note, noting the contents, in particular the recommendation that as a Task and Finish group, the recommendations have been completed. And I kind of hesitate to say business as usual. I think it is useful to actually give a plug to the fruit picking and foraging policy, because it's not well advertised. In fact, I know that not all officers were fully aware of it. So if we can sort of publicise it here and now, and obviously as sort of fruit picking season comes in, if our city council comms could actually do, you know, some communications around, because there's a balance, isn't there? You know, I happen to live near one of the Akenbury orchard, you know, and to see fruit trees absolutely loaded, but that fruit dropping and rotting in the ground is the most awful shame. And I know that also, you know, one of the aspects of the foraging policy is that in some areas or some locations, you know, people have been with a huge basket and absolutely stripped a tree and taken it all away for themselves. So it is about being considerate and proportionate and using the natural resources that we have in the city. So thank you for everybody, and people happy to note the recommendations. Thank you very much. And we do have an item of any other business, because there's been sort of recent announcement and updates with regard to the Household Support Fund.
Thank you, Chair. Yeah, I mean, we're still within the financial year for tranche 4 of the Household Support Fund. We received an allocation of £337,086, which was passported through Worcestershire County Council to Worcester City Council at the beginning of last year. Since then, so we came to committee last year to seek approval for how that funding would be apportioned, and have included that within the briefing note. Since then, we received a further £10,000 from County Council in March last year, at the end of March, just before the last year's provision ended. And then in February this year, we've received a further £10,000 allocated from County Council for the provision of, to provide support for food provision, as well as we have an underspend from the original allocation, which we had attributed towards marketing and promotion. So the reason that that's not been allocated is due to us being able to utilise existing provision, essentially. So utilising our community engagement team, working with partners, using social media to ensure the message has been getting out. And what we know is that the access to the scheme and the range of different provision has been extremely high. So it's left us with a surplus and underspend, essentially, coming towards the end of the financial year. We have continued to provide support for those households that would be eligible for free school meals, but preschool and college students. So the provision of free school meals lies with County Council for the sort of core eligible cohort of children that are in school. And we've, over the past 12 months or so, provided support to children preschool and then after they've left school. County Council had notified us that they were unable to make that, provide funding over the course of Easter. So Easter spans the end of March and April, but the funding was fully allocated. We've received notification that they also have an underspend, which we understand has arisen as a result of essentially where money's been allocated for voucher schemes and things where they've not been fully utilised. But essentially they've now confirmed that they will be providing free school meals across Worcestershire for the core eligible cohort over Easter. So as a result of that, we weren't originally intending to provide free school meals for the preschool and college students over Easter to remain in line essentially with the County Council provision. It would have probably been quite confusing, not for the eligible statutory cohort, but for us funding either end of that. So as a result of us having an underspend, as a result of County Council confirming that they are going to be providing free school meals, we've been able to extend the provision for the cohort that Worcester City Council's funded over the course of Easter, with any surplus from the underspend to be allocated to Worcester Food Bank. So due to the timescales that we've got before Easter, we've communicated that to the providers so they can communicate that with all the parents and pupils that need to be made aware to be able to start drawing down those vouchers. So the purpose is to sort of notify the committee essentially that we've taken that step and we've been able to extend that provision across Easter. We've heard that, well, the government announced, that there will be a 6-month extension to the Household Support Fund. So until this point, we were working on the basis that there hadn't been a notification and that the Household Support Fund would cease on the 31st of March this year. So it comes as welcome news that there will be an extension to the Household Support Fund, albeit only for 6 months. We have yet to have notification of exactly what that looks like, whether there'll be any different grant conditions associated to it. The amount that's been announced is in line with previous allocations, so we're anticipating it to be along the same lines, if not exactly the same. So we're just waiting for further information essentially on what that will look like, how much will be allocated to the County Council, and of that, what will be shared with district councils across the county, so we can determine how that was best to be allocated. So until we know what that looks like, we can't make a recommendation to the committee tonight as we would have hoped to. But obviously having quite very late notification of the Household Support Fund and a lack of clarity over exactly what that looks like, that will have to be brought back for approval at a later date.
Thank you very much. So yes, some updates on expenditure. Any questions or comments? Neil?
Thank you, Tom. And it's the end of the meeting, and I better keep it brief. This is an incredibly depressing thing to read, and we only received it today, so it's not a dig at anyone. It's just, that's a fact. It was an addition to the agenda, so we've not had the opportunity as a group to pore over it. So I'm using the platform to make comments. Bear with me. The County Council previously advised that they are unable to provide free school meals during Easter holidays. Well, that's incredibly grim. Then £18,000 have been found, including from an unallocated marketing and promotion budget. That's not good. Why is money being taken? The money should be there for the meals as opposed to being for marketing and promotion. The money should just be there. Shouldn't have to depend on an underspend on marketing. It's all the wrong way round, and I appreciate it's the County Council, not the City Council. And finally, the 6th of March, a few days ago, the government announced a £500 million 6-month extension to the Household Support Fund, which means that officers are hamstrung because they can't make long-term recommendations, and that says it all about local government funding in general, whereby we're staggering from 3-month, 6-month period, not knowing what the long-term future of local government is, and pots of money like this. So I am shamelessly using this as a platform to whinge about the lack of sustainable funding, and you can see that it has a very real impact. We're talking about, people going without food. So may I make a plea to whoever's watching this with the power to make a difference, to give local government more sustainable funding, so we're not having to have discussions about whether we might or might not have money to provide food for people in Worcester and the county. Thank you for tolerating me.
Thank you. Any other comments or feedback? It's probably worth saying that the the government announcement about the Household Support Fund earlier this month was as a result of lobbying by the Local Government Association and many councils, and certainly I was, as leaders of this council, we were signatories to that letter. So it worked up to a point. So to be kind of clear what we have got here, and thank you, know, it's unfortunate it's a late briefing. The Vice Chair and I, as soon as officers had the information about the underspend and the potential to provide some free school meals over Easter, that was shared with us, and we said yes, fine, you know, let's agreed with the decision to do that. The new money for the Household Support Fund for the first half of next financial year, as yet there is no detail as to what rules may or may not be applied to it and what, how much this council receives. Certainly over the 2-3 years of the Household Support Fund, there have been variations of criteria as to how it could be used. So we'll have to await that, and then the decision as to how we use our share will probably have to be as part of Managing Director's emergency powers, given the kind of gap between committee meetings, but that detail will come to this committee in due course. Any other comments? Okay, on that basis, thank you, Woody, for coming this evening. I close the meeting. Thank you.